Hi, welcome to this unique haircare initiative by IPCA. Mona Sharma, and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a chronic glory and makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle-age problem when you used to lose hair or a thinning hair or a bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well and much of the hair loss can be avoided. Today we have with us Dr. Deepthi Prasad, is a well-known dermatologist and has been practicing medicine for over many years now. She's MBBS, MD and specializes in dermatology, cosmetology and hair transplant. She currently owns her own clinic and practicing as a consultant dermatology at VP Hospital, Karimnagar, Telangana. Dr. Dupti has dedicated her career to diagnosing and treating wide range of skin and hair conditions by providing personalized healthcare services to her patient. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets the individual requirement. Dr. Dipti is also aware of the need for the patient awareness and education about hair care and spend a lot of time in giving doctor at various platforms across the country. Thank you, Dr. Dipti, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to this show.
Sure. Thanks for that. Thanks for the introduction. I'm very
Uh,
happy to be here sharing my views about hair fall.
we are also very happy to connect with you, Doctor. Thank you. हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया. So, Doctor, today we are going to talk about hair care in current scenario. So, whenever we talk about hair care in current scenario, the very common problem faced by all of us, irrespective of gender and age, is the hair loss. So, can you please enlighten us with your profound experience today? Like, we got a chance to know like what's normal and when to be concerned for.
Yes, please. So, this hair fall issue has become really important these days, irrespective of age. Say it may be right from your teenage or even younger kids, even going to the older age group. So, any age group where both males and females are experiencing different types of hair falls. So, it is a really important discussion that's going to be for next half an hour, I feel, and we should be able to give some important tips to the viewers about how to prevent the hair fall and what is that you have to check from within to control, to keep the hair fall under control.
uh, sorry, that's very interesting. So doctor, like is there any like very specific alarm signs like okay, if you don't go to the doctor now, then maybe it's too late.
Yeah, so that's very important for the patient to understand whether it is a serious hair fall issue or whether it is a normal hair fall that happens. So when I say the term normal hair fall, yes, normally also our hair tends to fall off little bit every day. And
Mhm.
coming to the count of the hair, we say around 50 to 100 hair. So hair less than 100 hair falling off daily is very much normal because hair
Mhm.
cycle is a continuous process.
Mhm.
Hair, you if you understand the hair cycle, there are three important phases in hair cycle called as anagen, catagen, and telogen. In the sense,
Mhm.
growing phase, resting phase, and falling phase.
Mhm.
So this cycle keeps going. So is continuous fall, and so is continuous growth. But
Mhm.
whenever there is any disturbance in this particular cycle, then you experience a significant hair fall. So the definition of significant hair fall is hair strands more than 100 per day.
Mhm.
So if you have patients, we can count the strands, or if not, in a normal person, especially in females with a normal hair length,
Mhm.
so much of ball of hair when you comb and when you make it into a ball, so much of ball of hair is significant hair fall.
Okay, okay. So when you see a bulk of hair and people start telling you that, oh my God, your hair is everywhere, you should visit to the doctor.
Yes, yes, definitely.
Okay. Okay, quite interesting, doctor. So, doctor, now that we know what is hair fall and when to be concerned for, another very common questions which is asked by all of us, and we keep people who are prone to hair loss, they keep asking to themselves, why me? Why it is happening to me? So, can you please like enlighten us today? Like, what are the general causes of hair loss?
Yeah, so coming to the causes of hair fall, nowadays, as we are going towards modernization, your lifestyle and your eating habits and your sleeping habits are changing a lot.
Mm-hmm.
So, there are many factors, many causes, out of which the most important cause could be number one, nutritional, especially in women, because of some deficiencies, or especially iron deficiency and specific vitamin deficiencies, or any kind of hormonal imbalance. Say it can be a thyroid issue or some kind of hormonal imbalance in females where the male hormones go high and the female hormones go low, the
Mm-hmm.
typical PCOS kind of profile, or it can be stress related, especially these days, young adults, stress in any form, say physical or mental stress, or any illness related stress. So, that also
Mm-hmm.
is a very significant hair fall. And
Mm-hmm.
most important is the baldness, patterned baldness, so which we see
Mm-hmm.
very common in men, the male pattern baldness, and little less common in females, that is female pattern baldness. So
Mm-hmm.
pattern baldness, which is once again because of your hormones. So these are the most common kinds of hair fall, we can say.
Okay, doctor, very informative. So, doctor, like another question is that nowadays we have are all like so busy and working late and eating like whatever we can, we eat and just survive this uh, busy work schedule life. So, can a
Yes.
person's lifestyle play a role in hair loss?
Definitely, definitely. If you see, if you just compare our lives, human life around 1 century before, and like at least 50 years before and now, everything was so systematic. Our sleeping pattern, eating pattern was systematic. And as we are going towards modernization, our lifestyle changes have become so bad, I should say. And that is giving you a kind of stress internally. We are living life, we are having good life, a very busy life and all. But internally, our health is not being maintained. So hair fall, you have to understand one important point. Hair fall is an indication of your internal health. So
Hmm.
everything is going systematically, then your hair should not be affected. So hair is something which the body tries to manage itself in all possible ways, and if it is not able to manage itself, then it shows in the form of hair fall. So it could be your nutrition status or calorie part of it, or when you're consuming more of junk. So nutrition doesn't reach the required RDA of the particular requirement of the body is not reached, because of
Hmm.
which you gradually go into deficiencies. That is number
Okay.
one. Number two, your sleep cycle. Whenever you are awake more than the late nights and your hormones get disturbed and your cortisol stress hormones increase and your sleep hormones are disturbed, so because of which again the internal milieu gets affected.
Hmm.
So your food, sleep, and most importantly, which we are lacking these days, is minimal exercise.
Hmm.
So
Yeah.
it was not there. A specific exercise kind of concept was not there 2 to 3 generations back. But now it has become an essential part because we need something to de-stress ourselves. The
Yes.
kind of stress which is building up in the body has to be
Hmm.
de-stressed with some kind of exercise, and we have to increase our basal metabolic rate. For which any kind of exercise, say it could be a walking or it could be gymming or any particular sport or just
Yes.
jogging, any kind of thing is important to keep yourself active from within so that your metabolism keeps going and then everything is normal. If your
Okay.
metabolism is not normal, nothing will be normal. So every organ will be affected and thereby it shows in the form of your hair fall.
Okay, so metabolism is very important, and we should take care of our lifestyle and live a healthy life no matter how much we are busy. So, doctor, like now that we know that the causes and why it is happening, so another very common questions and people are literally confused, like what are the medical treatment options available for hair loss, like surgical, non-surgical, or is there any oral also which we can take
Yes.
and manage our hair problems?
Fine. So before understanding the treatment options, first I want to tell the audience, like whoever is facing this particular hair issue, we have to try to analyze ourselves, like what could be the reason. So most of
Hmm.
the times it could be stress or because of you neglect your food. So try to
Yes.
take proper food and make little bit of lifestyle changes, eat good food, sleep timely,
Hmm.
do these kind of things for 1 to 2 months. So even then, if you're not able to control your hair fall, so if you feel even after 2 to 3 months of your self-care is not giving you what is
Hmm.
expected, then it is time to see your dermatologist. And also, most importantly, I want to mention here, there is a lot of quackery going on in India.
mm,
especially in the field of dermatology. So there are many other quacks who are ready to encroach into the actual science, and they label themselves as dermatologists and trichologists and cosmetologists, so called many fancy names.
mm,
But you have to always choose your dermatologist right, and
mm,
you have to choose them a person who a doctor who holds the degree, say it could be MD dermatology or diploma in dermatology. So these
mm,
are we are the qualified people who will be able to do a right justification.
yeah.
So this is very important for everyone to understand, because we don't want a dentist to operate on your body. In a
Mm,
similar fashion, we don't want any other person to handle your hair. So there
mm,
should be a right person. So choose your dermatologist rightly. So this is very important. And
mm,
most important step, what as a dermatologist we do is first assess the patient,
mm,
evaluate the patient. So take a
mm,
proper history. So what could be the reason for hair fall? So if you
mm,
are able to catch hold of the right cause of the hair fall, then the treatment
mm,
becomes easy. So that will be able to make out once you talk to the patient. So depending upon the causes and what could be the this thing, we may run some blood tests if required, and try
mm,
to assess the exact condition of the patient. So and
mm,
then we choose some treatment options. First line will be medical treatment, in the sense, once
mm,
again, people should be aware of a lot of places around the country
mm,
giving some packages, some
mm,
hair treatments, some
mm, mm,
serums, some hair treatments. So this is what important. Maybe that will definitely help your treatment plan, but
mm,
medical treatment is a base for everything. In
mm,
addition to medical treatment, if you want, you can take some procedural treatments.
mm,
But medical treatment includes, it could be some nutraceuticals, or it could be some supplements which the doctor feels might help you for the hair
mm,
growth and to prevent the hair loss, or it could be some medications in the form of serums. So there are a lot of serums nowadays available in the market, both OTC as well as prescribed medications. So choosing your right serum, the doctor takes that part, and medical treatments, your serums, and little bit of shampoos to take care of your external hair, and such things will be a combination of medical treatment.
okay. Okay. So the root cause is very important to be like find out so that the treatment can work on the person. Okay.
Yes.
Interesting, doctor. So, doctor, like nowadays there is a word called nutraceutical which is getting a lot of focus, and people are using it. So, but they don't know what is this nutraceutical and what is the role of this nutraceutical in hair health. So, can
Yeah.
you please let
So
us know here?
that's what. So nutraceutical, the term itself indicates something, uh, medicinal value for some
Mm-hmm.
nutrients.
Mm-hmm.
So especially in hair fall, so we have to understand hair fall is happening. So there might be, once again, as I told you, there might be some kind of deficiencies that are happening in your body. That happens once again because of malnutrition, or like if you're not able to take a proper balanced diet.
Mm-hmm.
So we have to understand here the concept of macronutrients as well as micronutrients. So macronutrients, we all know that, I mean, person with the science background will be able to understand this. So we have a balanced diet in which we take specific amounts of carbohydrates, proteins, and fats.
Mm-hmm.
So 70% of carbohydrates and your proteins, and fat 30%, 10 to 15% of your fat. So this is a normal balanced diet. But nowadays, because of various aspects and because of decreased quality of food, even if you take proper food, we are not sure what is the quality of food, what is the actual nutrients present in the vegetables, and because everything is adulterated. So that
Mm-hmm.
is the reason. There is everything is interlinked. We say that whatever is happening in our life, there will be an interrelated thing to it. So it is very much true. So whatever we are eating, it is not sufficient to your body in spite of taking so much of balanced food, because of lot of adulteration. That is very important. We cannot overcome that, because these are the resources what we have. But try to choose rightly. Go for organic foods, or try to raise your vegetables in your gardens, or like, there is some little bit of homework that we can do so that you can pick up good foods. That is about the macronutrients. So consuming carbohydrates, proteins, and fats in whatever the expected proportion and ratio will be able to give you right calories. If you replace your meal by one meal, for example, say you are eating a burger or a pizza, or something, some kind of junk food. So junk doesn't have any nutritive value. It is made up of maida, and the vegetable content will not be there. And one meal is gone. Whole month you eat such meals, for example, around 20 to 30 meals.
Mm-hmm.
So
Yeah.
body undergoes some kind of deficiency both in macro as well as micros. So
Yeah.
in that scenario, micronutrients especially, there are specific vitamins, B
Mm,
complex vitamins, and your trace elements like your selenium, copper, magnesium, and
mm,
biotin-based foods, and
mm,
specifically vitamin C, vitamin D,
mm,
can exclude your vitamin B12. So these are very important for your hair growth. So
mm,
nutraceuticals which have a combination of beautiful combinations. Nowadays we see a very good combinations in market
mm,
where whatever the nutrients that are important for hair growth to decrease the
mm,
hair fall, they are beautifully combined. So in the form of, say, it can be a tablet or it can be a gummies, it's the latest concept, or syrups, or it can be
mm,
some powders. So there are various types of formulations in market.
mm.
But I always request the audience to choose your nutraceuticals through a dermatologist because
For
everything is
sure.
costly. Everything is costly. So instead of trying yourself, mostly this
Mm,
Instagram syndrome we see nowadays.
mm,
Everything you try to buy it online and you try it, and again finally you land up with at a dermatologist. So
mm,
instead of doing that, it's hardly, it will take some time of yours and little bit of consultation fee. That is the only thing that you're going to expend. But if
mm,
you go through a professional, it will
mm,
definitely going to be a better treatment approach than
mm,
trying things by yourself. Homemade, home based remedies, yes, that you have to try. And
mm,
even when you're under a prescribed dermatologist medications, it is important to take your home based foods into consideration. So nutraceuticals have a major role if you have a significant hair fall, and depending
mm.
upon the type of the hair fall, nutraceuticals definitely have a significant role to control the hair fall and to give you new growth.
Okay, that's quite interesting, doctor. So, doctor, like you already said, there are so many products. So, do these products like herbal and these plant extract and these phytoconstant, do they really promote hair growth?
Okay, plant extracts, yeah, fine. So definitely, everything has a role. But once again, whether it is going to help you or not depends upon your hair fall severity.
Mm,
You are just taking a saw palmetto extract or only a grapeseed extract for a severe grade 5 allergenic alopecia. It's not
mm-hmm.
going to help.
Right.
Probably there is some kind of stress related hair fall, and you are
Mm,
noticing everything is fine absolutely, but you're noticing a little bit of increased hair fall for a couple of
mm,
days. Then
mm,
definitely you can try these kind of plant extracts or
mm,
in the form of oils or serums.
mm,
But if it is very severe, then these things are not going to help. So
mm,
phytonutrients, coming to these things, like there are a few specific products that we look for in the labels of hair serums. So it can be a saw palmetto extract or grapeseed extracts, or it can be your lavender oils and rosemary oil, onion
mm,
extracts, onion oils we say.
mm,
So these products definitely have a role at
mm,
various levels of hair growth cycle. So it could be they might stimulate some of the ingredients might stimulate stem cell. For example, there is an ingredient called as redensil, which is
mm,
basically a biotechnologically derived ingredient. So this goes
mm,
and acts on the dermal papilla cells to stimulate the stem cells for the hair follicle to grow faster. So
mm,
it can be some peptides, or it can be a saw palmetto. It's a natural DHT blocker, but as I said, it is only the first grade of androgenic alopecia, and
mm.
most of the times only single monotherapies will not be useful. So
Okay.
we have a beautiful combinations of all these ingredients addressing various aspects of the hair growth cycle. So given in a proper dosage and taken in a proper combination,
Mm,
phytonutrients definitely have something or the other role. And there are a lot of hair products which we prescribe as a
mhm.
dermatologist, which have these parts as the components of the serums. But
Okay.
monotherapies,
Mm.
they not may not be that challenging in treating the condition, but combination will definitely give you a change in your hair fall.
Okay, okay. So taking it by yourself, but not knowing the root cause, it won't work on us. And
That's what I'm telling. If it is minimal, you can try.
yeah,
You
yeah.
can try some serums. But if it is not being controlled, try for 1 month, 2 months, 3 months. If it is not under control, then it's waste of time to try more.
Mm. Okay, quite interesting, doctor. So, doctor, like you said that micronutrients, macronutrients are also important in our diet, and actually, we don't know what's like. as a common people, we don't know like what is this micronutrients. So can you please explain like what are these micronutrients or macronutrients in our diet, and what's the role of this micronutrients in our hair health?
That's what. So if there is a balanced diet, not just for a day, not just for a month, you are doing a balanced diet which includes the right macros and right micros, then your hair should be absolutely normal.
Mm-hmm.
But because of various unexpected things, our diet may go. We do a lot of fasting these days, and
Mm-hmm.
I have so many patients. In myself, I'm an intermittent faster. So
Mm-hmm.
intermittent fasting, it gives you definitely the result of fat loss or your expected weight reduction, all those things, but it will affect your hair because fasting is a condition. Though it is good for your body to lose fat, but your hormonal status will be little bit altered here. So
Mm-hmm.
fasting is a kind of stress. So stress hormone cortisol increases in your body, and that is not good for your hair.
Mm-hmm.
So that is the reason we talk about stress. Any kind of physical or mental stress is going to affect your hair. So
Mm-hmm.
definitely intermittent fasting, what happens is we tend to reduce the macros in the sense we don't eat the required calories. So whenever
Mm-hmm.
there is a calorie deficit or whenever there is a crash diet or
Mm-hmm.
whenever there is a kind of you're eating only specific foods for a long time, there is
Mm-hmm.
going to be deficit in your body. So
Okay.
then what is this one tip I give for the intermittent fasters? If you maintain your protein intake correct, say it can
Mm-hmm.
be 1 to 1.5 is little higher, 1 gram per kg body weight. For example, you're weighing 100 kilos, so you have to make sure you take 100 grams of protein, healthy protein, in your
Mm-hmm.
diet. So what
Mm-hmm.
happens that in a kind of it's an anabolic component. Protein is a it's a building block of everything. So even our hair, it's a keratin. Basically, it's a dead tissue, but it basically it's nothing but protein.
Protein, yeah.
So if you take right amount of protein in your diet with a little bit of deficit in your carbs or fats also,
Mm-hmm.
your body can manage to some extent to control your hair fall. But your
Mm-hmm.
diets and you're fasting, you're not taking your food properly, you're eating a lot of junk, and you're not
Mm-hmm.
taking protein intake rightly. So then definitely
Mm-hmm.
be ready for hair fall. So
Okay.
that is one thing. And people who fast or diet, make sure you take your micronutrients. So micronutrients usually include your vitamins B complex, or your vitamin B12 and vitamin D. Essentially, you have to check, and also your omega-3 fatty acids are also very important. Omega-3 fatty acids, these are essential nutrients which our body cannot manufacture by themselves. So essentially, we need to depend on external sources. And not only your hair, but your general body, various parts of our for body functioning. Your nerves are formed. The base of your neuronal system is a fatty thing, which you essentially need some essential fatty acids. And your health of the hair, the hydration, and the shine of the hair is important. And omega-3 fatty acids are important for that. So these are the important micronutrients which you have to take care. And the trace elements like your selenium, magnesium, iodine is also important. So iodine deficiency, if you see, then your thyroid hormone will be disturbed. So if your
Mm-hmm.
thyroid is gone, your basal metabolic rate is gone. And that is once again an important. So thyroid patients also are a very important group of people who experience hair fall.
Mm-hmm.
So thyroid needs to be maintained. So if you're already a hypo or hyperthyroid patient, or you're a normothyroid, but your iron deficiency you're going into, so there is a very much chance that you might experience a significant hair fall. So thyroid also should always be under control, and thyroid patients should check their TSH and keep it under control. Even if thyroid is under control, also there is a
Mm-hmm.
chance that you lose your hair. So your support through your nutritional system and your hair care is very important. So those
Okay.
are about the micro and macronutrients. So try to have a balanced diet, which includes right macros and right micros. So how to take right micros in your nutrients? So
Mm-hmm.
fresh fruits and vegetables, which are rich in color, that have a lot of antioxidants, and B complex. Fruits are rich in B complex, and vitamin C is one more important. Citrus fruits. Vitamin C collagen is important for protein formation, the keratin building up structure of the hair. Your vitamin C has a role in forming the structure of the hair. So vitamin C is important. Vitamin E, it's an antioxidant, it's a potent antioxidant that also combats your radical stress, oxygen radical stress in your body as well as your internal hair system.
Mm-hmm.
antioxidants. So these are very important. The basic important micronutrients you have to look
Mm.
for when you're eating your food.
Okay, so a colorful plate is important, so that
Green
we
leafy
can.
vegetables and one more thing, green leafy vegetables. And if you're a non-vegetarian, take
Mm.
your eggs daily and your paneer, dairy products, meat, organ meats. So
Mm.
these are all, where you can search your micronutrients, not only for hair. Your
Mm.
general health condition will be absolutely normal when you have all these things in your food. Need not eat
Mm.
everything in a day, but make
Mm.
sure you consume it in regular intervals so that your body stays in condition.
Quite interesting, doctor. So, doctor, like you also mentioned about this RDA. So, like also you said that there are many products on social media, and people do buy it and they take it and like gummies, they take it and pop it, and they think that okay, if I pop it a lot, then the hair will grow more. So, is it required to take these nutrients as per gender RDA requirement or under the supervision of the doctor, or is it okay like buying these products by ourselves?
That's what. So, being a medical person, I want to make audience understand that there is a difference in a natural food you take and
Mm,
a pill which you take.
mm,
So, for example, now you are looking for iron.
mm,
You are a severe anemic patient. Your hemoglobin is 7, 8. So 7, 8 requires a medical attention. That's a different issue.
mm,
But for example, you're anemic, little bit 10 around. So you have
mm,
to take iron-rich foods
mm,
essentially,
mm.
but you can also take in the form of tablets. So
Okay.
depending upon if it's a very mild deficiency, I
Mm,
advise patients to take in the form of oral things only, not only iron, any kind of nutrient in your body. If
mm,
it is taken in a natural form, that has a value.
mm,
So it doesn't have a sense if you take a lot of iron tablets and you eat junk.
mm,
You understand, right?
mm.
So
Yeah.
that iron is going into your body. It
Mm,
is going into your stores, but your body is not trying to heal by itself.
mm-hmm.
So then, what is the point?
Right.
So, what I want to mention here is
Mm,
you have to essentially take the nutrients, the required dietary allowances
mm.
in the form of natural foods.
Foods.
So as
Yeah.
I told you, it can be a biotin, it can be an iron, it can be a vitamin B12, vitamin D. Vitamin D is
Mm,
little different. You get it from sunlight. Your body makes it by itself
mm,
by exposing yourself to sunlight. So
mm-hmm.
that is. But nowadays we see a lot of vitamin D deficient patients in India, and there are a lot
Mm-hmm.
of studies
Yeah.
going on in this, and we see that there is genetic predisposition for Indians to go into this deficiency. So
Mm,
that in the form of supplementation regularly, that is okay, okay
mm,
to accept it.
mm,
But the other things you
mm,
definitely have to take orally, depending
mm,
upon your body status. In the sense, kids have little bit less requirement, and adult females and adult males have little bit of change in their required dietary
mm,
allowances of various nutrients. So
mm-hmm.
try to look for
Mm,
specific nutrients in specific foods. Little
mm,
bit of research around the nutrients will be good enough for you to understand what is the exact source of what vitamin and what trace elements. And if you're able to do that and take it naturally, well and
mm,
good. But
mm,
if you're going into a significant deficiency, which is showing in the form of hair fall or some kind of skin issues, for example, in omega 3 fatty acids, the essential fatty acid deficiency, we see a lot of rough skin, toad like skin, and the typical condition. So, in
mm,
such conditions, you have to give therapeutic doses. In the sense, the
mhm,
little bit of high doses, that is little different. But
mm,
required dietary allowances for
mm,
various set of people should
mm.
definitely be consumed, not only for the hair fall issue, but to generally keep your body in a regular shape.
Shape.
So, in
Okay.
spite of taking it through natural foods, if you're not able to handle it,
Mm,
definitely you have to take a supplementation and under a guidance of a professional. Don't just pop it by yourself. Just take a
mm,
consultation, and you
yeah.
just try to analyze your body status, and
Mm,
then uh, we are always there to help you in the right way.
yeah. Quite interesting, doctor. So, doctor, after like this hair loss, another very common problem which is faced by all of us is the dandruff. So, can dandruff also cause hair fall? Do we need to
Yes,
take
so
that?
dandruff is one more important issue. I understand. Every person in their life, at some point or the other, little bit oily skin people will face this issue. So
Mm-hmm.
basically, you have to understand dandruff is a condition in the sense it's not a disease as such. It's a
Mhm.
condition, it happens because of local fungus. So
Mhm.
it happens because of a fungus which is normally present on the scalp, and it is growing in number because of various disturbed scalp milieu.
Mhm.
So what happens in dandruff is there is a micro inflammation because of the infection, fungal infection on the scalp, and
Mhm.
thereby the scalp health. So it
Mhm.
could be a perifollicular thing, or it could be just the disturbed sebum content. The
Mhm.
quantity and quality of the sebum changes there. So because
Mhm.
of which there is a micro inflammation on the scalp. So any
Okay.
kind of inflammation, there is a chance that your regular hair growth cycle will be disturbed because of the
Mhm.
inflammatory cytokines. So the regular anagen catagen telogen will be definitely disturbed to some extent, because of which there can be increased telogen hair.
Mhm.
So then also it is important to keep the dandruff under control.
Mhm.
And importantly, we have to understand that dandruff being a condition, it can come back if you don't take care of yourself properly. So keeping it under control, if your scalp health is good, it is not
Mhm.
having any inflammation, your dandruff is under check, your hair fall can be under control. But yes,
Mhm.
dandruff can cause little bit of hair fall, and if
Mhm.
it is not taken care properly, you might lose little hair, but it
Mhm.
is reversible. Once you treat
Mhm.
that, it will
Okay, so severe, like normal, like severe dandruff should not be avoided. It has to be
severe
treated.
dandruff. Once again, if it is a severe dandruff, if you are not able to control it, so anti-dandruff ODC shampoos and all, then it is a medical condition. So you have to see a dermatologist. It could be a simple dandruff, or it could be a sebopsoriasis, or it can be a scalp psoriasis also. We don't understand because that is not controlled by regular shampoos which we normally use at home. So then it is time for you to evaluate it properly. So there you need to definitely consult your dermatologist. If it is something more than dandruff, then you have to treat it. Then only the hair fall will be controlled.
Okay, interesting, doctor. So dandruff is also an important part to take care of. So, doctor, like after like you also mentioned about lifestyle, and in lifestyle you talked about sleep, diet. So, one thing in our lifestyle is the stress, which is unavoidable. So, can a stress impact hair health, and how can we manage our stress?
Yes, this is also very important because nowadays there is no person without stress.
Mm,
So speaking in terms of medical language, I want you to understand few conditions. It can
mm,
be a physical stress. For example, you are suffering from some kind of illness. Now there was COVID recently.
mm,
We have seen a very bad COVID pandemic, and there were patients who completely lost their scalp hair.
mm,
Complete
mm,
bald they went to because of the stress. COVID is not known to our body, and the kind of stress body undergoes is very, very extreme. So
mm, yeah.
during stress, what happens? There is a sudden, a break in the
Mm,
growth of hair.
mm,
So the anagen hair, the growing hair suddenly goes into telogen because the
oh,
body is not able to handle the stress.
mm,
So what
mm,
happens is whenever there is any kind of stress, so it can be illness-based stress. You suffer from some kind of fevers, any chronic fever, or
mm,
like any acute illness, a COVID or any typhoid or any dengue. So these kind of fevers will definitely make you experience some kind of hair fall 2 to 3 months after the episode, because we take so much of time for the hair to go into telogen and fall off.
mm, mm,
So it can be a physical, stress in the body, illness-based stress, or it can be a mental stress. So something happens in your family, any loved person, you lost a loved person, or you had a very disturbing part of
mm,
your life, a phase which you
mm,
are facing a very stressful condition. So such things also may give you an acute hair fall, which is experienced once again 3 months later of that particular episode. Once you're
mm,
out of the stress, your hair
mm,
grows back. That is the beauty with the hair. So that's
yeah.
called as telogen effluvium.
Mm,
In the sense, the effluvium is more in number. Telogen is your falling of hair. So whenever the falling hair
mm,
uh, happens which more in number than expected, then you say experience a significant hair fall, and there will be thinning. But if you take care of it, you support it, it can come back. And postpartum telogen effluvium is one more important. So you
mm,
deliver the baby, and after a couple of months,
mm,
so because of sudden withdrawal of the hormones and this thing, there is a little bit of hair fall within 3 to 6 months that should come back to normal.
mhm,
But now we see that postpartum telogen effluvium is not coming back normal, and they're gradually going into chronic telogen effluvium, which
mm,
finally may also go into pattern
mm,
baldness. So that is
Okay.
because of, once again, your underlying nutritional deficiencies and
Mm, mm,
not taking care of yourself properly.
yes.
So
Mhm,
nutritional with the stress-induced hair fall together can lead to chronic telogen effluvium. So
mhm,
definitely there is a role of
mm,
stress. But again, you have to identify the stress. If it's something which you can do, you can handle it by yourself. Definitely, you have to
mm,
do something from your side. Now, as a part of stress relieving procedures, once again, as I told you, some kind of exercise in your daily routine. Morning,
mhm,
half an hour to 1 hour, spend for yourself. Whatever
mhm,
is the scenario, try to do some exercise, walking, yoga, pranayama, meditation. And also,
mhm,
there are important kriyas these days, not to promote anything, but there are some important yoga
like
practice
this. Mm,
meditations,
mm,
yeah, like
mhm,
Sudarshan Kriya and your
mhm,
Shlokavi Mahamudra. So
mm,
these are very important yoga practicing techniques,
mm,
which definitely have a role in your stress relief mechanism.
mm, mm,
And I feel every individual,
mm,
whoever is like having an active lifestyle and very stress-based lifestyle, I want every person to do these kriyas.
mm,
Choose
mm,
whatever is good for you. But that
mhm,
half an hour, 20 minutes of de-stress meditation act, if you continuously keep doing in your life, in your
mm,
routine you include, it is
mm,
going to have a positive change. So it will make
mhm.
you cleanse you from inside. So
Right.
that
Yeah.
stress. So once you are relieved by your stress, definitely things will settle down in the body and your hair also grows fine.
Yeah, okay. So hair is equally important in our lifestyle, just like diet and exercise. So, doctor, like when we are stressful, the very common formula which is applied by all our mother is hair oiling. So they say that do this massage, the stress will go away, and they also say that okay, apply a lot of oil. Next day, your hair will grow stronger and thicker,
Yeah.
and people do it and they sleep overnight thinking that next day morning the hair will grow more. So what do you think, what's the fact behind this oiling hair is good?
Actually, that's what in Indian market. Uh, being a dermatologist and as well as an R&D cosmetic person, I believe that in India we have a little bit of hype for hair oils. In the
Mhm.
sense, like there are few countries all over the world who use hair oils, and frankly speaking, hair oil is not that in European and Western market. Hair oil is not at all used as
Mhm.
your general skincare, hair care routine. But
Mhm.
we do use. Definitely, there is some role or the other for sure
Mhm.
in the form of it can be a kind of supportive system where you apply hair oil, you do a little bit of massage using your fingers and all. So the scalp health is maintained. So the blood
Mhm.
circulation in your scalp improves. So
Mhm.
in an indirect fashion, once the hair follicles are improved with blood circulation,
Mhm.
definitely there will be something or the other effect on your hair growth,
Mhm.
provided everything is normal. If
Normal.
again there is some actual deficiency or actual trauma, any some pathological problem with your hair, then
Mhm.
hair oil is not going to help you much. That is
Okay.
one important part. So as a maintenance, if you have a habit of applying hair oil, you can apply.
Mhm.
But
Mhm.
if you are a patient who are having a lot of dandruff issues,
Mhm.
no, oil is not advised. Maybe for conditioning effect, you can apply it 1 hour before, weekly once or twice. That is just to make your hair shaft smoother.
Mhm.
Second point that we have to understand, hair oil is a very huge molecule. If you see coconut oil or almond oil, the particle of that particular oil is very huge.
Mhm.
So
Mhm.
for actual hair oil to go into your scalp and reach the hair follicles, it is
Mhm.
not possible. It is
Okay.
going to stay on your scalp. It is
Oh.
going to stay on your hair shaft.
Mhm.
But there are few oils now in market where are these oils are little bit impinged by few actives.
Okay. Okay.
So the
Mhm.
active size, so it is, if I'm not wrong, it must be less than 500 kilodaltons, the size of, I'm not sure of the size. So
Mhm.
that particular active should be so much sized to go through the skin barrier and reach your hair follicle and go and target the particular site.
Okay.
But
Mhm.
hair oils, usually crude hair oils, doesn't have the
Mhm.
problem.
Mhm.
But to some extent, they
Mhm.
might have some extra herbal extracts or some, if it is enriched oil, to some
Mhm.
extent, definitely it has a role. For example, rosemary oil, we say.
Mhm.
Rosemary oil also is very important to improve the hair growth. It also improves the shine of your this thing.
Mm-hmm.
But only rosemary oil, if you go on keeping, probably you will maintain your hair health. If it is very much normal, you can maintain, and probably that maintenance will not give you hair loss. So this
Mm-hmm.
can, so there is one property with each oil which is good, and I hope that the real extracts from those actives, for example, rosemary extracts. So if these are you're able to use in the form of serums or oils, then that will be more beneficial. But I completely leave it to the person. If you are fond of applying oils, if dandruff is not an issue, please go with it. If you are no, if you don't want to apply, just avoid it. So this is
Okay.
how I use.
So it's nothing like necessary. You have to apply or something
Not
like
at
that.
all. Yeah.
Okay. Okay. So quite interesting, doctor. Now my favorite part. Can you give us some important tips for healthy hair?
Okay. Fine. It is nothing but the gist of whatever we spoke now.
Yeah.
So try to stay healthy from within.
Mm-hmm.
Staying healthy means your mental health as well.
Mm-hmm.
Nowadays, which is very difficult uh, to have both physical and mental health because of various issues, something or the other mentally will be disturbed. But
Mm-hmm.
we have to take our own responsibility. Say
Mm-hmm.
it can be a physical part of it or mental part of it. No one is going to come and help you in any way.
Mm-hmm.
So you're an adult, you have to take care of yourself, you have to feel responsible of yourself. So we
Mm-hmm.
say that in Vedas and all these holy scriptures, our body is considered as temple.
Mm-hmm.
So so whatever we put inside, both physically as well as mentally, has an effect in your general health. So
Mm-hmm.
try to stay healthy from within, both physically and mentally. Take a balanced diet, both macros as well as micros. Try to search newer ways of taking micronutrients. There is a concept called as microgreens.
Mm-hmm.
It is definitely there in practice since many years, but now it is becoming a little bit more trending of micronutrients in the form of saplings. It can
Mm-hmm.
be a saplings, a mustard seeds, or it can be a dhania, whatever it is. So you have to start eating the microgreens. So it is
Mm-hmm.
not very difficult. Nothing is difficult. It is just that you should be committed.
Yeah.
Don't be lost in your daily life. We are working hard in various fields. You're earning money only for yourself. You
Yeah.
should be your priority.
Yeah.
Your health depends upon what you eat and what you think. So eat right, sleep right, stay healthy by doing some exercise, do meditate, and also try to maintain your micronutrients in the form of fresh fruits, vegetables, greens, eggs, your paneer. Protein is very important component of your diet. Don't just eat a meal just like that, whatever is there. Try to analyze what you're eating. What is that you're going to get if you eat this? How is it going to affect your body? So this particular orientation, if you start doing from within, definitely you'll see a change. So I wish, as a dermatologist, I wish and hope my audience or whoever is going to watch this video should be able to take home points from this, not only dermatologically but also spiritually, because maintaining your inner health, both physically and mentally, is very very important
Mm-hmm.
to achieve something in life. So be thankful for whatever we have in our life, and we should cherish it. And that can happen only when you are positive. Be positive from within. Try to do your work, give your fullest, whatever you're
Mm-hmm.
doing, whatever maybe the job it is. You try to give your best in it, and first take responsibility. You are
Mm-hmm.
responsible for yourself. Don't expect anything from anyone. When you start doing all these things, then positivity builds up and your internal health will be better. And overall, now we're talking about hair, so our hair will be healthy, and we should not lose hair. And because hair is very important for every person,
Yeah.
and the very appearance and confidence is defined by your hair. So I hope and wish we are able to convey some important tips with
Yeah.
this conversation.
Yeah, I'm sure, Doctor, the discussion is very informative. I'm sure our viewers have found the session very helpful. So, Doctor, I'll quickly take one question from our audience because we are running out of time.
Yes, please. Yeah.
He's been asking this question. Hi, doctor. I'm from Telangana and I have androgenic alopecia. I'm also diabetic and I have tried all vitamins and minerals. I've visited many doctors, but my hair is not growing back. So I'm thinking of hair transplant. Do you do hair transplant? How to get your appointment? How can I fix my hair loss?
Okay. Yeah. So first we need to assess what is the degree of hair fall. So you said you have tried all possible things. I also want to understand, did you really try minoxidil and what is the duration that you have tried for? So if it
Mhm.
is depending on the your treatment plan depends upon the grade of the allergic alopecia you have. So I need to look at you first and before telling something. So I will leave my hospital contact in the chat here, so
Mhm.
that you can contact, and once I see you, I'll be able to guide you in a better way. Yeah.
Yeah, yeah. So he can get your. He can also Google your name
Yeah.
and find you. Yeah.
You could our website, the hospital website is also there, so you can just directly go and see for the contact.
Okay, doctor. Thank you so much, doctor, for your expertise and sharing all your answers, answering the questions and sharing all your expertise with us today. I'm sure our viewers have found the session very helpful and very beneficial. Thank you so much, doctor. It was delight to have you, and thank you so much for your valuable time.
Thank you. Pleasure is all mine. Thank you.
Yeah. Thank you, ladies and gentlemen, for joining us today and asking questions. I'm so sorry I could not take all the questions, but yes, we'll take our appointment of our doctor again and we'll get with a new topic about hair and care whenever doctor have time and we'll cover all the questions.
Sure.
Thank you so much, doctor. Thank you so much, and thank you so much, everyone, for joining us today. Let's have a good day. Bye bye.
Bye.